Hey, what's up, Internet? Today I want to talk about healthcare, or maybe just health in general. Bernie Sanders has gained a lot of traction with the youth, and maybe not the public at large, but the idea of universal healthcare is definitely much more prevalent now than it has been in the past. And there's a couple things I want to talk about why I feel it's a bad idea, and it's not as it doesn't work out in countries that do have it as well as Sanders would have you believe, and others. Uh, Before I talk about maybe the economic incentives and structure and repercussions of trying to give out a finite resource or service to almost an infinite need, a person's health is vastly determined by their life choices. It's been a little while since I read the statistic, but I saw somewhere that estimated maybe 80 to 85% of healthcare spending is on ailments and diseases that are preventable and are directly associated with lifestyle choices. So basically, to things that are avoidable, to things that are preventable, if only people decided to take care of their bodies. And I think everybody's probably pretty familiar with the stereotype or the saying, or maybe they're not, but at least my brother's a doctor, and I've talked to him a bit about this, where barely any patient ever takes the warnings or the recommendations of their doctor in order to become more healthy. Whether that's to lose weight, eat less fat, or whatever, or actually take your meds, whatever advice doctors dole out to people who come to see them, vast majority of the time, it is not followed. And so if you look at these points kind of from the macro level, is that people's health are it's their choice for themselves and no one else. And no one else can make you be healthy. And you are the only person that can either increase or decrease your quality of life through your choices. And that's the fundamental point that a universal healthcare, or I guess a universal insurance or single payer provider misses, is that even if everybody is covered, you can't make people healthier if they live a sedentary lifestyle and eat too many calories and smoke or eat too much red meat or whatever it is that's harming you. You can't make people stop doing it. And no amount of pills or insulin or whatever is going to make these people stop doing what they're doing. Maybe there's a few people that do actually change, but not many. And if you look at the statistics on how many people actually follow through on a diet or their plan to lose weight, that's really low. And then what's even lower are the numbers of people who follow a diet, lose the weight, and then gain it back. That's huge. There's only a sliver of people that have ever, or at least that are tracked, that lose the weight that they want to and then maintain the healthy lifestyle and the healthier weight. And so it's fundamentally, I'm beating the dead horse here, but your health is dependent on you. It is not dependent on whether Uncle Sam is paying for your birth control or is paying, helping subsidize your insulin or your lisinopril. That shit's superfluous. It's small and petty compared to what you can do in your own life, but you refuse to do or you neglect. Okay, now going on to a little bit more of the economics of it all. So Obamacare started off with the premise that they wanted to insure 40 million more people. I believe that was the number. I don't think they've hit that number yet, and I think there have been a lot of people who have been dropped from their plans. But regardless, it doesn't. This point doesn't necessarily hang on whether or not Obamacare has increased the number of insured or not, which I would guess is maybe marginally. How are we going to supply all this healthcare, all these services and products and medical devices to everybody in the country? Because all they ever talk about is increasing the demand for these services and products, but they never address how they're going to increase the supply. We only have X number of doctors in the U.S., and I believe that less and less Americans are going to become a doctor nowadays. A lot of times, we have to import doctors into the U.S. Right there, the key portion of the of the whole healthcare industry, the doctors to hand out treatment and diagnose and treat and all this stuff. We are not making more of them, and if anything, we're making the industry so displeasing and so hostile that we're going to create less doctors going into the future. In addition, what are these grand central planners going to be opening more factories and companies to produce all these needed devices and supplies and everything else? No, they are only interested in just trying to spread out what we have right now across as many people as possible, which means that there will have to be rationing and there will have to be long waiting lists like there are in other countries, like in Canada, in the UK, in Europe. I've heard a lot of stories and I've seen a lot of articles talking about the wait times for these countries that are often held up as the gold standard. Now, right, maybe your easy fixes like getting stitches for a cut or getting treated for low-level medical issues, maybe that's might be treated at a relatively okay rate. But what about your serious medical conditions? I've read in many places, I'll try to find some to post in the description, about people having to wait 6 months to a year for serious, invasive, urgent surgeries. That's part and parcel for the whole centralization of industries. The government, a side product of the government expanding the base of covered individuals, is going to overwhelm the ability for everybody to get treated. And so everybody will just get equal shitty treatment. The government is incapable of managing industries. And the harder and harder it hangs on to the medical industry, the more expensive it's going to be, the harder it's going to be to get treated. Because it's impossible for them to react to market forces, because they're operating on the assumption that they could just pass a law or a regulation and just force people into filling the roles that they want, even if there are no incentives for them to do so. Right now, many doctors are dropping government insurance because the payout is so low. And in order to make it worth it, they have to treat dozens and dozens and many more patients that they would have to otherwise just to break even, just to make it worth it. If we expand that to the entire nation, how is that not going to be the case? Just look at the VA. I think the VA is a really good indicator of what happens when the government monopolizes an industry, or specifically the medical industry. It's a direct correlation. And they have a massive waiting lists and issues with treatment and all sorts of craziness. And this is something that they control from end to end, and they can't do it. There are estimates. Just today, I was reading estimates of Bernie Sanders' budget for the next 10 years if he becomes president. And there are massive, massive costs associated with it. Like, I believe one article said it could be as much as 17 or 18 trillion over the next 10 years. And then I saw another article where The Economist, and I think this might have been the New York Times, so it was not a right-leaning economist or journalist that was writing the article. It was actually somebody who was probably more likely than not want the same thing that Sanders wants. And they estimated it to be higher. So I think it was like 27 trillion, up to 30 trillion. It's just undoable. It's crazy to think that people will think that this will save them money when in reality it's going to cost everybody an amazing amount of money. Okay, well, not everybody. The poor, yeah, obviously lower income level earners will disproportionately draw from the system, and they'll get the better deal out of it. But the middle class and up will definitely not draw as much out of the system as they pay in. If you look at rates of obesity amongst the population, lower income and socioeconomic populations tend to have more obesity, which equals more cost. This will be a direct funneling of money from earners to non-earners. And it's not to say that poor people shouldn't be treated, or people who have medical conditions shouldn't be treated. No, they should be, absolutely. They would get better treatment for less if the government wasn't trying to micromanage an entire industry, adding incredible amounts of administrative costs and compliance costs, baking it into everything, and then expecting the middle class and up to pay for it. And all the while using taxation and fines and stuff to pay for it, which removes the industry and the services and the products from any level of feedback from the system. Because if it's a bad if on the private market, if it's a bad product, if it's a bad service, people will not buy it, people will not engage in it, and then those providers will have to better themselves or get run out of business. And since the government is immune to that market force, they inherently will find it much more difficult, and I would say impossible, to meet the demands of a system that they would create. Okay, well, that's all I had to say about that for now. Thanks for listening, and I'll see you guys later. Live free.